So thank you so much, Dr. Wilson, for doing this interview with me on behalf of myself and Disability Rights Louisiana. We have wanted to do these interviews with gubernatorial candidates just to basically get a feel for your perspective on the issues affecting people with disabilities so that your voters with disabilities can have some idea of who and what they're voting for. So my first question to you is, what is your assessment of the accessibility of healthcare and home and community-based services for people with disabilities here in our state of Louisiana?
Great question. It's super important because it speaks to citizens all over our state and the advocates for individuals who are impacted. We've been ranked 50th for our healthcare system, which I think is unacceptable. And it's time that we do something to improve our overall healthcare system, as well as the access to affordable care. Both accessibility and affordability is absolutely essential. The safety and wellness of our citizens has to be a number one priority, not necessarily just in terms of their physical safety from a crime perspective. I understand that's a big important issue for people all across the state, but the safety and security that's sustainable for them to be able to achieve institutional support and security, things like ensuring that our healthcare system and our transportation system and our educational system gives a sense of security and safety for them to be able to achieve the level of what they absolutely want to do to achieve. And so overall, I will tell you, I think there's a lack of access to home and community-based services, which I believe is fundamental for someone's quality of life, particularly as we deal with certain physical challenges, some mental challenges, and it's even more exaggerated in rural communities. The system that we have is extremely complex. Sometimes it's overly burdensome for individuals, making it difficult for people who need these services to achieve the types of outcomes that they really want. And quite frankly, that's why we have these systems, to help people achieve a quality of life and a sense of wellness and well-being. And if the system we have violates that or makes it more difficult, then we're doing more damage than good. According to CDC, 1 in 3 adults in our state has some kind of a disability. And that is unfortunate, but it's the reality we live with. Disabilities have no regard of person, rich, poor, black, white, Republican, Democrat, it doesn't matter. What matters is that it's an individual here in the state of Louisiana, and I am committed to working with individuals and citizens in our state so that we can achieve a level of wellness with the outcomes that we deserve. I have members of my family that are experiencing certain disabilities, and how we have to, as a family, provide services for them. And I've witnessed and lived firsthand the burden it places on other members of the family, but we are committed to doing that, whether it's a physical illness or a disability or something cognitive. That's an important thing to say. So I guess in summary, I will tell you our system is somewhat disjointed. And that we have barriers, but we can overcome them if we work together. If we're able to communicate and partner and collaborate with stakeholders and providers and use the systems and services of government to ensure that we're building on a system and not building blocks in that system, so that our state can be much more efficient and effective. As governor, I'm going to step up and be the quarterback on this issue. We will maximize those services and implement using best practices and ensure that there's a concerted effort, not just at the Department of Health, but at all agencies, to be more inclusive and more thoughtful to ensure that we have a robust state response to assisting individuals with disabilities. That's an important thing for me. And there are a couple of things that I will tell you as governor I will work on, particularly when it comes to funding. We witnessed this legislative session, how others in this race actually did something very reckless and passed a budget that eliminated $100 million plus, if I'm not mistaken, from Department of Health. The problem with that is it had a multiplier effect of 7. And so other dollars would have been reduced had the governor not been able to step up through Joint Legislative Committee on the budget to fix those things. That is the kind of thing that we don't need, because people's lives and their well-being depends on some of those decisions. And as the only candidate with over 25 years of administrative service, integrating federal and state dollars and following those rules, I understand the severity of what happens when you make these kinds of reckless decisions, particularly with federal dollars. We deserve a governor in this state that will advocate and fight for us, and not one that's going to allow those types of federal dollars to be wasted. I also know firsthand what our workforce challenges are. And those workforce challenges are, again, exaggerated in rural communities that will further impact the disability community because of a lack of people that are there. We have to have funds, but we also have to have funds to be able to invest in building a workforce that's going to be stable and deal with the growth. We're living longer, which means we have people who might have disabilities, cognitive or physical disabilities, that are going to live longer. And so we have to have a more robust workforce. So we need to put forth incentives that will create a pipeline of healthcare professionals and administrators and providers that will take care of our attendants or take care of the individuals and be those primary care attendants for individuals. I'm the only candidate that is committed to raising that minimum wage financially to make those incentives that will think about the two most valuable entities we take care of, our little ones, either in early childhood education, or those who are seniors, or those who have some disability that are dependent upon others to maximize their quality of life. Clearly, we need to do a better job of incentivizing financially, as well as providing benefits and training to ensure that they can grow. And then last but not least, I can't help but think about the disparity of health outcomes in this state. As the only person of color, one of the major candidates, I should say, and having lived in communities that have disproportionate statistics for outcomes, I am cognizant of these health disparities and what it might mean for minority communities and what it might mean for poor communities in terms of insurance and healthcare. I'm the only candidate who on day one said I was going to maintain the Medicaid expansion, because over half of our population depends on Medicare or Medicaid to be able to have the care and coverage that they need to be healthy. Without that type of service, we're going to be in a tailspin financially. And so I am committed to addressing not just the financial stability of this subject matter, but also the equitable distribution of these to ensure that the disparities that we see existing in our state get the type of attention that it absolutely deserves, so that you can afford that kind of care, that you don't have to worry about the disadvantage that you're going to be at because of other factors like race, socioeconomic or zip code conditions. Those are things that we cannot allow to continue, because we're disproportionately impacting the statistics of our state when we only focus on a certain population. And so let's target the problem. Let's make sure that we have an equitable distribution of those resources to address those health disparities. And when you get into those health disparities, you will see where we need to spend more efforts and more resources. And I'm going to be a governor who can do that. We've got an insurance crisis in our state. So it's more important for us to do it, not just for the wellness of that individual, but it's also important for us to do it for the financial stability of our state and the ability for the governor, I think, to ensure that insurance works for you, that it works for our citizens, as opposed to working against them. And so the financial implications, again, are exaggerated if you're in a rural community, but they're also exaggerated if you represent one of those groups that are disproportionately represented in some of those healthcare disparities. And then, there are organizations that we absolutely have to partner with. I can think of the Split Second Foundation, an entity that worked with me not too long ago. The Affiliated Blind, I did an activity with them when I was a student government president, where I actually acquired a disability for a day, a physical disability, to see the struggles of what it means in everyday life, to learn how to live independently and to live well. Working with the Split Second Foundation, we experienced what it's like to maneuver around an urbanized area with very difficult conditions. And I am more proud today of things like the new ferry terminal that made transit accessible, the work that's happened at the Superdome to make it ADA compliant, the work that we've done at the Department of Transportation to ensure that we had accessible curbs and that we had elevated crosswalks in design to be delivered because they're safer, that we're using design standards that are more inclusive and respectful of individuals with challenges, and efforts to work with our TNC community, the transportation network companies, to make sure that they're having vehicles that can provide safe transport for individuals with some physical challenge. And those are important steps. That's how you achieve a quality of life for a community. And as governor, I'm committed to do that.
Thank you for all your efforts and commitment to this wonderful state. You kind of touched on this, but I just want to ask this concretely. what is your assessment of the mental health care system? And do you have ideas on things that you can do to improve the system as governor?
Yeah, great question. And you're right, I did hit on it because you can't talk about the disability community without accepting the fact that there's other kinds of disabilities, some that are known and not known, some that are visible and not visible. And the mental health crisis that we have in our state is one that is not always visible. There's a tremendous lack of mental health services. We saw the attack on these services in the General Administration, and we have yet to build back a system to be able to meet the current needs. And so we've had 8 to 12 to maybe 15 years of individuals not getting treatment. And we wonder why this problem is much more exaggerated. That's why we have to do things like maintain the Medicaid expansion, how we have to expand behavioral support services, why we have to bring counseling back into the public school system in a very robust way and invest in that network. That's why we have to have beds and availability for treatment, not just interim treatment or immediate treatment and care, but long-term services as well in the community level. As a state, this has to be a priority because it's going to affect our community one way or the other. I believe, the only candidate in this race that vowed to protect and expand, as I said, the Medicaid services with a proven record and a commitment to do it. I'm not putting any caveats, no quotations, no but or what if or ands. I'm not going to extrapolate that. I'm going to do it and do it in a big and bold way so that we can expand to provide the mental health support services for behavioral health as well so that our state can thrive. They're promising investments at local government levels also. And not only am I committed to the Medicaid expansion, but I'm also committed to supporting local governments. And when I think about ITEP, for example, that put $254 million back in the hands of local government, allowing them to make the decisions, that produced money that they can now invest in local public health. That's why communities and some organizations are creating a mental health team that goes out on calls that the police department is sent out on to be able to provide the proper intervention for that to happen with dedicated revenue. That to me is absolutely a needed investment. As governor, I'm going to work with our federal partners to seek out other available resources, both from government and the nonprofit community, to make investments here, because there's a large network of people that see the value of this wellness, that will invest private dollars to make this happen. Organizations such as Disability Rights of Louisiana, the National Alliance for Mental Illness, Split Second Foundation, Affiliated Blind, a host of them, all of these advocates have meaningful lived experiences that can help guide the growth and the direction of our state and the path forward. It's important for us to not only address this within the public space, but also within our institutional system. So when you think about our criminal justice system, what kind of assessments are we providing for juvenile offenders? What kind of interventions are we providing for them? What are we doing for pretrial imprisoned populations who might need mental health and mental services and counseling to improve their conditions, assuming that one day they're going to get out? Ignoring it during that time frame does not make sense. It's not the most effective use of their time or our time, even if they've been a violator and have done something wrong. As I've traveled the state, I was with the sheriff of a major city yesterday. And one of the things we talked about is the large number of folks who are integrated into the criminal justice system, but have mental issues as well. Because of some of those gentle cuts that were made, eliminating what was available in the urban area, then moving into the North Shore, eliminating that and saying, just go to the hospital. The emergency room is not where you go for those types of services and treatment. You actually have to go to a proper place for that. Going to jail is not the way to treat mental illness. And that, unfortunately, what's happened in many cases, not all, but in many cases. So let's go look at what we have there and make sure that we're providing those services. Those efforts go a long way at increasing systemic accountability and upholding the rights of individuals to achieve a level of wellness. Louisiana is ranked 35 in our nation for access to mental health services. We can do better than just being 35th in the list of 50 states. We have experienced dramatic increases as a result of the stresses of the economy, of dealing with COVID. God knows the natural disasters have taken people to the brink, dealing with an insurance crisis. All of these things are creating mental stress on people that we have to understand is beyond just the nation, but is unique to Louisiana. Many of those needs are not being met, and we can't be healthy, we can't be prosperous as a community, as a state, if we don't address those needs. The societal gap is huge. When you think about the number of people that we see living in public spaces, those people who are unhoused, that number has exponentially increased, not just in urban areas, but in rural areas as well. You see increased domestic violence, increased drug use and overdoses, poor educational outcomes as a result of the lack of behavioral and mental support services in institutions, and high rates of unemployment. So there's a lot to go around that contributes to the mental well-being of a community. And in turn, it not only affects that community, it affects that system, whether it's emergency responders, whether it's public schools, whether it's the prison system, whether it's the funding that's available and the strain that it puts on our budget. I'm committed to working with the Office of Behavioral Health and Louisiana Department of Health to overhaul those gaps, to fill those gaps with services in a meaningful way, in a sustainable way. That includes streamlining our system so that we can get care to the residents that absolutely need it, and that it's accessible, and that it's affordable, and that it is not making things worse for our state. We have a bed shortage, as I mentioned before. We need to make sure that we fund the types of services, not necessarily by creating more government bureaucracy, but working in the private sector. I think there's a great opportunity to do public-private partnerships and encourage more of these services available to individuals, particularly with the Medicaid expansion. I'm committed to working, as I said, to centralize those types of treatments, to be less restrictive and less costly in delivering those, and help people do that necessarily, not just institutionally, but do it at home, in their communities, in the systems that we provide, to provide a wraparound approach to dealing with mental services. And lastly, I am committed to advocating on behalf of the citizens of this state with private insurance companies, with other stakeholders like yourselves, to expand the in-network options for mental health care and to minimize the out-of-pocket costs so that we do not do more damage and create more financial burden on families when insurance is spiraling out of control. We know 50% of our people can't afford the basics of transportation, food, healthcare, childcare, and education. Asking them to bear the burden financially of mental health is, I believe, much more extravagant and much more complex, and we need to avoid that at every cost. And so I'm committed to doing that to protect not just those families and those homes, but the communities and the state, not just fiscally, but as a value of life, a quality of life. Those are things that we have to invest in at the state of Louisiana. And that's what I will do as your next governor.
Thank you so much. And thank you so much for everything you do. And Disability Rights Louisiana is always here if you need any expertise or any answers to anything. But before we close out, do you have anything else you'd like to add?
Well, listen, I would just ask that you continue these kind of dialogues. I will always maintain an open door. I'm very proud of my record of working with the disability community, not just at the Department of Transportation, where we were recognized for what we were able to do, by working with the Governor's Council of Disability Affairs, what we've done in the area of rural transit, what we attempted to do with TNCs to ensure that there was safe, equitable access for individuals with disabilities, those with children and child that need, child safety seats in vehicles to make sure that they're available. It's been my honor and privilege to serve the state of Louisiana, and I would like nothing more than to be your governor to carry forward on those issues that I've mentioned in this discussion. I'll be a partner with you like you've never had. I will support this community in ways that no other governor has ever done. It's important for us to maintain ADA compliance and accessibility, but we have to do it for the right reasons. We have to be multimodal in our approaches. We have to take advantage of our federal resources, and I've been able to do that. I'm the bridge builder in this relationship, in this candidacy, in this race. I'm the one that's overcome these hurdles of partisanship. I'm the one that's worked with federal government officials to bring resources here and committed to ensure that we delivered them in the most effective way. And I will do that with the disability advocates across our state, not just in campaigning, but in serving for the next 4 and potentially 8 years here in the state of Louisiana to improve the quality of life for all of our citizens, because you're absolutely valued and appreciated and needed in a Wilson administration, not just in terms of a partner, but someone who's going to be a part of the team, someone who's going to sit at the table and help make decisions and ensure that every agency in state government is equally accountable to the needs of your community. And that's what I'm committed to doing. Thank you for the opportunity to speak to you today and be a part of this very enriched discussion. It means a lot to me. And I'm sure it means a lot to all those folks in your community that may not be aware this conversation is happening. So I encourage you to visit us at wilsonforla.com, understand our positions and our perspectives, learn a little bit more about me, and compare the records, not the rhetoric, but compare the record of accomplishment that we offer and what's unique about a Wilson administration. And I guarantee you, you will be able to support us. Vote for us, contribute, volunteer. You're welcome to be a part of this movement.
Thank you so much, Dr. Wilson. And I hope you have a nice day. And thank you so much for your time to the disability community. And we hope to speak with you soon.
All right. Thank you so very much.
You have a nice day.
Bye-bye.